Good evening, everyone. So I think a lot has changed since we um, last recorded a video session, and there are quite a bit of questions that I left unanswered because I had logged off by then, and so a lot of questions came after, and I would like to address them. Now, what has changed since the last time you saw me? Um, Quite a bit, but one of the things that was asked in the group was whether the pregnant women can get vaccinated. And so now the ministry has started vaccinating women who are in their 14 weeks plus gestation. And so that's clarified. There were some other questions that came on after I left, which were related to pregnancy or breastfeeding, or you know, how to nurse a child when you're positive or the child's positive. Um, there was a question just before I logged off, Joe. So you're saying children are safe. Actually, if you go back to the video, you will find that I've actually said that the previous strain was not as strong as the current one. And I clarified that not only do I have COVID patients who are children, the youngest one is 3 months old. So even with the previous strains, you were getting child infections. It's not like they're not gonna get sick. They might not get as gravely sick as an adult, but they do get sick. There is no way that a child will not get sick coming in contact with a COVID virus. So I hope that answers your question. The other question that I couldn't get at that time was how risky is COVID for kids, and if a feeding mother gets COVID, should she continue feeding the baby? So if you go to the hospitals and get tested, well, at least I've made sure that the previous hospital that I worked in and the current one that I'm working in, that every patient that was tested and was a potential COVID patient, we would give them a small paper which was printed both in Arabic and English, and it had been given to us by the Ministry of Health as well. So we had printed multiple copies of those, and we give it to the patients who we think are going to test positive to safeguard their interest and their family's interest. What that paper usually suggests is how to take care of your family members if you are COVID, and if you are somebody who's taking care of somebody who is a COVID positive patient, what are the steps that you need to take to safeguard yourself, the patient, and to keep the infection limited to a room rather than the entire household. I think there's a lot of emotional attachment between family members, and therefore the safety netting that the ministry or the doctors here have put up for those patients is kind of neglected. So far, it's very rare for me. I'm not going to talk about everybody else. I'm talking about me personally. I haven't come across a family where one member tested positive and the others didn't. Either A, because by the time they tested positive, they had already been exposed to other family members, or by the time, you know, they became symptomatic, they had already passed on the virus to other members, or whether it's because there is a general lack of understanding towards that, this virus doesn't care that if it is XYZ person who has it, and they will be able to pass it on, and therefore the contact is not limited to such person because of multiple reasons. I'll give you a few that my patients have told me. Mother is old, she got COVID, she's okay, but I can't leave her alone because she can't take care of herself. Completely understandable. I understand and I respect that, okay? Parents are supposed to be taken care of, and if they are sick, that you are directly responsible for taking care of them. However, the ministry has actually given you a paper, and it is available on their website, and it is available on their Twitter handle and on their Facebook feed, how to actually safeguard yourself while you're taking care of your parents. Now, I did manage to see a handful of people taking precautions while taking care of a family member, but majority of the time what I've noticed is that kind of barrier that is supposed to be set up is crossed, and therefore it's not just one member who gets positive from COVID, it's pretty much the entire household. So as far as your question is concerned, how risky, Farah Mahmood, yeah, how risky is COVID for kids, and if a feeding mother gets COVID, should she continue feeding the baby? In that pamphlet, in that brochure, that little paper that tells you about safeguarding yourself, it does tell, and it's available on the ministry websites, Twitter handles, Facebook feeds, that if a child or the mother is positive, how to safeguard the child, okay, from getting COVID. How to wear a mask, how to clean yourself prior to feeding, what are the precautions to take, and the child should be fine. Because the virus doesn't really pass through the fluids, like the colostrum or the milk. At least it's not proven so far. So we hear everything new about this virus every day. But so far, scientifically speaking, antibodies can pass through the milk, but not the virus itself, unless it's contaminating the surface, and if you don't clean prior to feeding and then you pass it on, that's another story. But yeah, there is a minimal risk if you take precautions, and there's a full risk if you don't. I hope that answers the question. Should a feeding mother take COVID vaccine? Any risk for baby? No, so far they can take vaccines. If you look at the Ministry of Health pages, they have actually outlined the number of question and answers related to the vaccine in very detailed English and Arabic versions. And Families in Oman has been updating them quite frequently, passed on by me. And so yes, the feeding mothers can definitely get vaccinated without any problems. Shaila Rahman, the gap time between my doses was a lot longer than the recommended 10 weeks. Is this a problem? Does it reduce the efficacy of the vaccine? Okay, the promise is taken prior to you getting the vaccine that you will show up for your second dose. And it is a kind of a legal binding document, but it is not enforced as such, because we're talking about people with normal lives, and emergencies do come up, and sometimes they are late, but it does not justify getting too late. You can get late by a day, maybe two, but you can't justify getting late by weeks. So what does it do to the efficacy of the vaccine? Now, if you look at my previous video, I tried to explain how the immunity process works, okay? And how these immunoglobulin M's and immunoglobulin G's slowly and gradually, their titers, their levels rise as you are exposed to the antigen or the protein or the virus. Now, the recommended time period that was calculated according to not only the availability of the vaccine, but according to the immunity process, was calculated between 8 and 10 weeks to be the maximum gap that should be given. You would still get an immune response on the second dose if you were gapped between 8 to 10 weeks. The most of the people living abroad in the US, Canada, Europe, they're still following the protocols of 4 weeks to 5 weeks, and getting vaccinated again. To their calculations are based on the immunity process, not just anything else. But in other countries where sometimes, because of the number of vaccines needed and everything else is more, say for example, our homelands, it sometimes requires a calculation which is slightly different. So an 8 to 10 week would still give you a very prominent and a very good response for the antibody titers to rise. But getting later than that, it might not give you a strong enough response, but it'll still give you the response. Only time will determine, as this is a younger vaccine, but with all vaccines, the rule of thumb is that there's a certain time period that is that is calculated according to the need of the vaccines and immunity process. Um, this is something that we need to understand. Now, I hope that answers the question. I don't think you need to get vaccinated one more time. There are, however, uh, now some things, standardized things that are about to come up in countries. This hasn't been implemented worldwide yet, but there is a trial going on regarding the AstraZeneca, whether a third booster dose should be required or not. Only time will tell us that if the two doses are enough or a third booster dose is required, and therefore we will be able to figure that out in the coming days. All right. There was another very lengthy question by Sasan Obusedi. So Sasan asked me, thank you God for all you're doing, especially out of control numbers. We'll make videos about why it's important to socially distance and wear masks. Sasan, I just couldn't agree more. Socially distancing and wearing masks is just so important in dealing with this surge of cases and all that's happening at this given moment. What to do if a family member gets COVID and how to safeguard the rest of the family and the people around you. I told you about the brochure that the Ministry of Health has published and has been given to most of the people who are testing positive. If some of the people are missing out on it and the hospitals are not following the guidelines where this paper should be given to every one of those people tested, I'm very sorry that people have to go through that. I know people that have been exposed to COVID and had symptomatic child that they were nursing the day before yet come to work and they have to expose their colleagues. All right, the guidelines for quarantining and coming in contact with somebody who's COVID positive or symptomatic. Around the world, including Oman, I have not found companies that are telling you to come to work if you're symptomatic. In fact, they are encouraging that if you are symptomatic and if you are somebody who thinks they might be COVID positive, please go quarantine yourself, get tested. The rules of the quarantine are they're slightly separate for the healthcare workers and slightly separate for the general public. If you have come into a unsafe contact, which means, say for example, a family member who's COVID positive, you're not wearing a mask, you're sitting next to them, you're supposed to get quarantined for 14 days. Now, if you do develop symptoms in between, you are considered as something called a probable COVID-19 case rather than a suspected COVID-19 case, which means you probably have it. Now, it is encouraged to get tested for documentation purposes, but regardless, we can enter you into the terrorist system as a probable case, and therefore we can quarantine you accordingly, and then once we have quarantined you, and we can de-isolate you according to the ministry's rule from the terrorist system. It is, however, again, encouraged to get tested if you are symptomatic. It helps you make better decisions, okay? There is no other reason for it, it just makes you make better decisions. If you are symptomatic, if you're somebody who's got a cold cough, tell your immediate in charge, supervisor, manager, whoever it is, that you are somebody who's symptomatic at the moment. Go to your nearest health facility. They will issue the certificates that are necessary to quarantine you or to get you tested, and you can take it from there. Play it by the ear. Also, if you are somebody who has come in contact with a COVID patient who is a family member and it's an unsafe contact, which means no mask, no social distancing was there, then you need to quarantine also, okay, for 14 days. The rule is for 14 days for coming in contact because you're unsure when the symptoms will develop. That's why. For a person who's tested positive, it's 10 days. On the 11th day, if they have had no fever or no symptoms which are, suggestive of the active infection, for 48 hours without medications, you can de-isolate. So that's the 11th day. You would be able to do that. Wearing masks, social distancing would have to still be priority even after vaccination. More addressing the issues and the surge when you constantly flood WhatsApp and other social media platforms with such videos in English and Arabic to raise the key awareness. I've noticed that there has been quite a bit of surge in the WhatsApp videos and Facebook videos and Twitter handles by not just the authorities but also by the general public enforcing and educating people about social distancing and wearing a mask, and you know keeping the quarantine procedures intact. There has been quite a number of these videos that I've come across in different languages. I've seen them in Arabic, I've seen them in English. In fact, I actually saw one video in Bengali language and one in Hindi, one in Malayali. So there are quite a bit of videos that are coming up, and they're actively informing people about this procedure and the importance of masking yourself and socially distancing yourself. Now here I would like to tell you two particular things. One of the things is that if you get vaccinated, as I've said that in my previous video as well, and I'm saying it again, you still have to follow wearing a mask, socially distancing, because the vaccine doesn't prevent you from getting an infection. If you have an unsafe exposure to a COVID virus patient, you will get positive. However, if you are fully vaccinated and proper immune system has taken shape and form of immunity, and you are somebody who's at this point immune, you will probably not have a very bad disease. You will have quite a bit of the symptoms, but you will not have something that will require hospitalization. But saying that, I also need to tell you, a very extremely small percentage of people around the world, while these trials of these vaccinations are going on, have ended up requiring minimal hospitalization even after getting vaccinated completely. But again, no problems more than that. Okay, so absolutely, Sausan, is really, really important that we do wear a mask, socially distance, keep our colleagues and our family members safe, even if we are vaccinated. And as people usually nowadays use social media as their primary source of information, yeah, why not educating? This video, I don't make videos. I just thought that maybe it will help out, and that's why I started. And I hope it is reaching the masses and it helps out. It's a small effort on my part to help out in information and getting the right information out. So just like me, everybody else has the right to do these things as well. And I was, I was fortunate enough to actually reach this particular platform and then inform the people.
Okay, there were some questions that came in through inbox.
All right.
Some people who have gotten vaccinated, obviously with the two, either Pfizer or AstraZeneca, develop certain symptoms, or side effects rather. So how do you differentiate between side effects and whether they're developing the virus, and typically how long should the side effects last?
We have noticed that with either one of the vaccines, certain number of the population who get vaccinated develops some sort of side effects of the vaccine. They're not very bad. They will probably develop soreness at the site of the injection, which could be taken care of with ice pack applications, or just soothing the area with an ice pack. Other than that, certain people have started getting fevers. We expect that. We just like if you get a vaccination for chickenpox, or if you get it for measles, if you get it for certain other diseases, you will develop a fever. Not everybody. Some of the population has a stronger immune response, and therefore they will develop these symptoms. And it usually lasts 72 hours, and after that it tapers off. The fever and the body ache, something called myalgia, or post-vaccination myalgia. Some people are developing headaches. These are all temporary, and they last a very short period, usually 72 hours. If you have a fever which is lasting past that, say for example a week, then you need to get tested, because you're at this point at a position where you need to differentiate whether your symptoms are being caused by the vaccine or by another disease. So you need to get a workup done. So this, I hope it's not it's not an absolute thing. If 72 hours have passed and you're still having a high grade fever, okay, you don't need to get immediately tested. You have to see a doctor who will then weigh in whether this person is somebody who needs to get tested. It is a clinical picture they have to go through. They have to go through a little blood workup and figure out if you're one of those people who might not just have had a post-vaccination fever and myalgia, or instead if you're one of those people who have either contracted COVID or some other disease which is causing these symptoms. So obviously, post 72 hours, if you're still having this, go visit the doctor. Prior to that, just take paracetamol. These are minor symptoms: body aches, headaches, and fever, okay, lasting 72 hours. Post 72 hours, you need to go see a doctor. What can you do to take care of the body ache and headache and the fever? You just need to take paracetamol. You can take it as frequently as 6 hourly, depending upon your weight. The calculation of the dosage is there. But for an adult, typically we give a gram of paracetamol 4 to 6 hours according to their need, and that usually covers everything. Anything else? Any other questions?
For those who develop COVID, they say that past the 14 days, when they've done retests, they still test positive.
Yes.
And when they want to travel, that becomes an issue. So,
All right, so I deal with this every single day, and there are a number of factors you need to understand. A lot of these people who are going to end up getting COVID, we have had reports of patients testing positive for up to 6 months, some 3 months, some a month. Some have become negative within the first 10, 11 days. So it's different for everybody. The reason your PCR is positive post-recovery is because it's not that the active virus is with you. It's probably because there are viral particles that are still circulating inside your body and nostrils, and therefore it is causing the test to become positive. However, we have been blessed by the ministry to be given these certain travel certificates, the Ministry of Health certificate for travel. There are two types of them. There's one which is a regular one, which is a negative test, and then we give it to you and then you fly out. There's a positive one as well. So if you are somebody who's testing positive but has gone through the quarantine, is asymptomatic, and are COVID free, so we have that kind of a certificate as well, and every hospital carries it. What we do is we take your initial test report of getting detected, then the second test report which says detected again post quarantine, the de-isolation certificate, a certificate saying that you had quarantined for the recommended number of days, you are not symptomatic anymore, you are de-isolated, and then the Ministry of Health certificate saying that you are a positive but fit to travel. And it is a set pattern, you just have to print it out at the hospital. And then you have to get them attested, and then you fly out. However, this is where the other factors come into play. It depends on your destination. So some destination countries will not take this. They want a document which says you are negative. They will not let you travel. So although it is possible with certain countries to reach them via this procedure, it is not for others. So unless you are tested negative for certain destinations, you will not be allowed to fly, although you are somebody who is asymptomatic, you cannot spread the disease, you have gone through the quarantine procedures and everything. Now, a lot of people that come into the hospital and say that, okay, so I've done this, and I answer them this question and I explain it to them, they get really angry. They lose their patience. I understand that there's a lot involved. There's the tickets, the travel, the destination, the reason for the travel, the cost of the tests and everything else. I understand all of that, but these are not things which are in my hand. The ministry has actually given us a way out of this. Whether the destination country accepts it or not, it's not in our hand. We can recommend ways out. Whether another state, country, destination accepts it or not, it's not in our hand. We can't enforce it. Hope that answers the question.
yes.
All right. Well, guys, the situation is kind of quite dire. Um, it's a very lengthy day every day. Um, I just cannot emphasize enough how important it is to not be somebody who is irresponsible. And I need to enforce this, and be, I need to really strongly assert this, that even 2 years later, there are people that are unable to wear a mask properly. I mean, it is beyond my understanding. It is beyond my comprehension. How could this much news over a period of 2 years, which explains the importance of masks and social distancing and hand hygiene, prevent a person from wearing a mask properly or socially distancing or taking precautions, being negligent towards somebody else's life and health? It is beyond my understanding. I don't know. It is not the responsibility of the government alone to safeguard your lives. They have tried and done everything by the book, everything possible. They have gotten the vaccines here, they've gotten all the hospital setups, the amount of man hours we're spending with patients, and the amount of work each one of the healthcare workers and the Ministry of Health is doing every single day is beyond comprehension. Our days are literally never ending. I mean, you can blame everybody in the world you want, but at the end of the day, it is people who do not adhere to the guidelines that are going to end up causing more problems. Blame whoever you want to blame. If you are somebody who's not taking precautions, who's not wearing a mask, is still going to gatherings, is still holding, weddings and parties and birthdays and whatever, you are not part of the solution. You're part of the problem. And literally, it takes away your right to protest. Literally, it takes away your right to protest. So I couldn't assert more. You really, really need to be safe. This is an extremely bad strain of virus out there. I'm dealing with an extremely large population of sick people every day. My colleagues are beyond tired. We are exhausted. We are literally tired. We emotionally, mentally, physically. You guys need to figure this out. The guidelines are there. Everything is online. All the material is there. Videos, pamphlets, brochures, papers, stickers, posters, you name it, they have it. It's just a matter of adhering. If you see something wrong, if you see something that is going wrong, please, even if the other person is and he doesn't want to follow the guidelines, at least register your protest by telling him, wear your mask properly, sir or ma'am. Tell them it's okay. At the most, what they're gonna say, no, but at least get it into a habit that they should be doing this. Don't pick a fight. You don't need to pick a fight. You just need to inform. Most of the people are going to understand and listen and eventually do this. If you see something like a gathering or anything like that going on, the numbers are out there. The government is asking. Report to us and we will help. You just need to have a little courage and go ahead and report it. It's okay. I hope you guys listen and understand. We're getting very tired, so the sooner we practice this, the sooner we get out of this. So I hope you guys, are safe and remain safe and stay healthy. All right. So take care of yourself and have a good night. Bye.